Okay, hello. Um, over the summer, I got diagnosed with thyroid cancer. During that time, I kind of wanted to vlog about it, but there's just so much going on, and I was so overwhelmed. I just didn't, and I honestly regret it. But it has been, let's see, 7 months since my diagnosis and my total thyroidectomy, and I'm feeling great. And I just wanted to share my story with you guys and maybe like ease the minds of those who are going through a cancer scare, or they've already been diagnosed and they're getting like all of these new terms, they're not them, and it's so overwhelming. Cancer, oh my god. I understand it can be very scary. So I just wanted to take some time out of my day and make this video for those of you who are going through this. I'm fine. I'm feeling great. I understand that you're scared right now. You might be overwhelmed, or maybe you're not, but I know I was scared. And I know videos like these were super comforting, and oh god, thank God for YouTube. So yeah, I just thought I would make a video, talk about my experience, maybe clear some things up, you know, ease your minds. So yeah, I'm just gonna start from the beginning. This is gonna be kind of long, but I mean, I'm sure like if you are going through this, then you're gonna want like it to be as thorough as possible. At least I wanted the super thorough videos. Okay, so like I said, I'm gonna start from the beginning. Looking at pictures from when I was 16 and 17 now, I noticed I had the lump. Of course, then during all those photos, I thought I just had a huge neck. I thought I just had an awkward looking neck, and that's just the way I was. I was also dealing with a lot of depression and anxiety, and I just thought, I'm just a teenager. I'm transitioning into an adult. This is normal. Because, you know, like, everyone during that time is dealing with those emotions and stuff like that, but I did notice that mine was a little bit more extreme than my friends, even though they were, you know, dealing with things like I was really dealing with things. Like, I wouldn't even be going through anything stressful, and I would have like this crazy anxiety and depression, and yeah. But like I said, I just thought I was a teenager. Yeah, it sucked. But anyways, so flash forward a year or two. I was getting ready in the bathroom, and I was about to go somewhere with my family. My father walks in, and I guess to see if I was ready to go, and he was like, "What is that on your neck?" And I was like, "What is what?" And he's like, "There's a huge lump on your neck, Courtney. Like, has that always been there? That hasn't always been there. Like, there's a lump on your neck." And of course then I was like, no, I don't know. And I just looked in the mirror, and I just looked like this, and I was like, oh my god, what is that? Why didn't I ever see that before? From what I can understand, or from what I've been told, thyroid cancer is a very slow growing cancer, which is good. Cancer's not good, but this is good. So since it grows slowly, you don't really notice it. Like, you don't notice the change, your body changing. Kind of like, I guess, you losing weight or gaining weight. You don't really notice it until after it's like huge, and you're just like, oh, what have I done? But it's the same thing. Like, I just didn't notice it. I was going through some other things at the time, and that just wasn't really focusing on like my body. I don't know. So yeah, shortly after that, we made an appointment with an ear, nose, and throat specialist. We didn't know who to go to, so we just assumed the ear, nose, and throat specialist would know about the throat. So we went in, and he was like, yeah, you just got a nodule, it's fine. They did a fine needle aspiration, and that came back benign. Most nodules do come back benign, by the way. I will get back to the fine needle aspiration later. But so they did that, came back benign. They did blood work. My thyroid levels and all that good stuff was normal. Doctor was like, okay, you're fine, just keep an eye on it. And basically I just let it go. There was a brief period of time during all of that I was researching, and I was learning about thyroid cancer and grave disease. But you know, you research I have a headache on Google and it shows up you have a brain tumor. So you just learn not to take those things that seriously, and since the doctor said I was fine, I'm probably fine, right? No. So a year goes by, still dealing with those symptoms, gaining weight like crazy. Yeah, I don't want to talk about that part. That part is bad. I'm still working on that, but whatever. I'm cool. Whatever. But anyway, so still dealing with the same symptoms. My boyfriend was like, that's not normal, like you need to go get that checked out. And I was like, yeah, I know, but the first doctor said I was fine, so I'm probably fine. It wasn't until it started stinging that I was like, yeah, something's wrong. It shouldn't be feeling like that. And I just, like, a lot of tightness and uncomfortableness in my throat. And I noticed, like, whenever, you know, like when you're really stressed, like your throat kind of tightens up and you feel like you got a lump in your throat. Well, when you really have a lump in your throat, when you feel like you have a lump in your throat, it's kind of just like super uncomfortable. So yeah, I was just like, yeah, this sucks. So I went to my primary care doctor, and he referred me to the endocrinologist. Endocrinologist specializes in all kinds of stuff, one of those things being the thyroid. And this was last July. I walked into his office, I waited in his room, waited for him to come and see me. It took him maybe 3 minutes of examining me to tell me, yeah, you need surgery. You're gonna need surgery, like, you should have had surgery like last week. Like, that needs to come out. And I'm just like, what? I've never had surgery. I've never even had my wisdom teeth out. Like, it was really scary. I was just like, no way. So yeah, right then I knew, oh my god, this is gonna be a long journey. Of course, I'm feeling very scared, and also, like, kind of, I don't know, I was kind of excited, because I was like, yeah, like, finally, this is gonna get taken care of, something that's been there for so long, like, finally gonna figure out what's going on. So anyways, I think it was a few days after that appointment, he did another fine needle aspiration. This looks more scarier than it is, okay? And basically what they do is they numb your neck, they stick a needle in it, it's about this big, and they suck out samples. Depending on how big it is, they're going to do an ultrasound and to measure it and stuff like that. Depending on how big it is how many samples they need. It's like two samples per every 3 centimeters or something like that. Mine was like 5 or 6. It was pretty big. Yeah, pretty big. So they had to do like 2 or 3 samples, and I cried. Yes. And honestly, I'm just a big baby. I don't like being poked with needles. It doesn't hurt. Pinch your arm as hard as you can. That's about how bad it hurts, and it's like it's pain, but it's tolerable. It's uncomfortable. They stick it in and they kind of move it around. It's not fun. It's really not fun. Okay, and then after that, they send off your results, and then you play the waiting game. And this waiting game felt like an eternity. When the results came back, it was basically said that it was like undetermined, like it was possible that I had cancer, but they weren't sure, like the cells weren't well differentiated enough for them to be able to diagnose it as thyroid cancer, if that makes sense. Which makes sense, because I eventually was diagnosed with follicular thyroid cancer, and that's what that means, is just that the cells weren't well differentiated enough. And honestly, I still don't understand what that exactly means, but I'm just like, okay, whatever, cool. But anyways, back to before I knew my diagnosis. I had to do a CAT scan on my neck area, and this is basically to help the surgeon see, basically to prep him for surgery, or prep you for surgery, so they can see inside and what they need to do and stuff. Anyways, yeah, it was pretty big. I wish I had like some sort of imaging. I do have this is the cytology report. I don't know if you guys can see it, but yeah, that's what my thyroid looked like. The thyroid cancer, at least. Yeah, that's about the only picture of it I have, unfortunately. It was huge. Like I said, my doctor was like, yeah, you should have had this out a long time ago. And that was really scary to be told, because I was like, did it spread? Did I leave it in too long? Did I wait too long to do something about this? My big thing was, did it spread to my lymph nodes? Did it spread, like, at this point in time, I didn't know what kind of cancer I had, and I was just reading about all the different kinds of thyroid cancers, and although most of them have really good prognosis rates, some of them are, they're just not, they're not very good. Fortunately, if you are young and you catch it when you are young, you respond better to the treatment than if you are older, which is very sad, because this cancer is so treatable. It's just when you leave it untreated for so long, it's able to spread and worsen. But like I said in the beginning, it's a slow-growing cancer, and that works out in your favor. Cancer is not good, but the fact that it's slow-growing, that means that you have a chance to do something about it before it gets to that point where it's just so bad. And yeah, so I guess I would talk about my surgery. I stayed maybe 24 hours, I think, maybe a little bit more. It was a very easy experience. I think I cried before I had my surgery, because like I said, it was like my first surgery, and it was super scary. But it was really easy. It's like they rolled me back there, and the next thing I knew, I was awake and everything was fine. I was crying a lot. I don't know why. I wasn't sad or happy or emotional. I was just crying, and that's just a side effect of the anesthesia. And I was throwing up a lot too, unfortunately. That sucked. But, well, I don't know, I guess they could have prescribed me something for the nausea, but I never had surgery before, so I wasn't able to prepare. So if maybe it would be a good idea to ask your doctor if you can have something for nausea before you have your surgery, because I know throwing up after having neck surgery, like, that freaking sucked. Like, I wouldn't wish that on my worst enemy. That was miserable. And then you're also like you're on morphine and stuff like that. So like throwing up while you're on morphine, having to get up and go to like the bathroom and stuff like that, like every time I stood up just to go pee, I would throw up, and it was just so painful. Like, oh yeah, that was bad. But that was honestly the worst part about it. Afterwards, after it was out and I began taking my Thyroid, I began noticing amazing changes within 2 days after my surgery. I wasn't able to talk loud. I wasn't able to yell. It was like I had the power to do it, but it was like there was something blocking it. It was the most annoying thing ever, and I sounded really bad. I sounded like very hoarse all the time. I sounded kind of manly. Yeah, that was bad. It was really bad because I worked at a Starbucks, and you have to like call out your drinks and stuff, and I would just be like, no, that's kind of exaggerated, but yeah, that's what it felt like. But yeah, you kind of want to, you can eat normalish foods. I would recommend eating mostly soup right after your surgery, and like I eat a lot of frozen fruit and cold things. It kind of feels like you have a sore throat, and that's just where they have like that breathing or thing like in your throat. I don't know, but it really wasn't all that painful. Honestly, it really wasn't. It wasn't as bad as I thought it was gonna be. And even the scar, I thought it was gonna scar really bad, but as you can see, like, what scar? Where is it? I don't know. I don't see any scar. It's there though, right there. But yeah. So I had my surgery. I'm taking my Synthroid. About a month later, or a few weeks later, it's time for me to go for my post-op. And at the time I didn't really think I had cancer, so I told my dad to stay home. I went by myself, and well, I went with one of my friends, but I didn't go with like a family member because I thought everything was gonna be fine. I thought it was just gonna be like post-op. But anyways, I walk in there, and he's like, "Where's your dad?" And I was like, he stayed home. But I knew, like, when he asked me where my dad was, that he had bad news. And so instantly, like, that was like the worst feeling. Oh my god. And then he just looked at me and he was like, "Well, you have cancer, kid." And I just immediately like burst into tears. I was like, "What do you mean? What?" It was so bad, just being like alone with a doctor telling you you have cancer. Like, probably one of the worst experiences of my life. Yeah, that was bad. But as I started crying, he was like, "Calm down. It's not that bad. It's really not that bad. Like, you already have had it you've had it removed. You're taking Synthroid. Like, everything's gonna be fine from here. Like, you're gonna be totally good. You're young. This has a good prognosis rate. Like, you don't need to be crying. This is not something to cry about." But I'm 20 years old, and I just got told that something was wrong with me, and I had just gone through so much already. I was just like, no, I hate this. I was just so emotional. And then it was really, I guess, telling my family that I had cancer was really hard too, because they barely knew anything about it either. And telling my friends, oh god, that was so hard, and it was so sad. I was so sad. Telling my boyfriend was really hard. Cancer is no fun. Cancer sucks. Anyways, so the month I was waiting to do my radiation, I was really angry. I felt depressed. I felt very anxious. I was just going through like all kinds of emotions and stuff. Like, even though like I had been told that I was gonna be okay, like it was still kind of like a mind-opening experience, being told that you're sick at a young age. And like it's very sad always having to constantly get blood work, being told you have to take a medication for the rest of your life in order to function properly, having to have surgery, having to tell like your mom and dad that you have cancer. That's like some pretty tough stuff. It really is. But I just wanted to start eating better and exercising and just change completely and never have this happen again. And I've been like that ever since. Like, I've just wanted to be healthy and prevent it from happening again, because it really is the worst. It sucks. It sucks. But it's not the worst thing that can happen to you. Like I said, I feel amazing. Like, I feel better than I have felt in a very long time, and I'm so glad that I got that crap done when I got it done, because cancer is cancer. That's all there is to it. Like, cancer sucks. But anyways, radioactive iodine. Let's talk about that. Radiation. Okay, so basically, I went to this hospital that specialized in different cancers. It's in Atlanta. I live in Georgia. So I went there, and I went to the radiology center. They gave me this shot that was supposed to, like, help with your thyroid hormones or whatever. And then the next day, I went to take the pill. It's just a pill. It's really nothing. But it's funny because, and here's what I like. Okay, they have this big metal box, right? And inside of that box is a smaller box. And inside of that smaller box is this little tube. And inside of this tube, there's the pill. And the doctor was like, okay, pick a hand. You need to take this tube. Do not switch it in between hands. You take it really quick. With the hand that you took the pill with, you touch the cup. You put the cup to your mouth, you swallow it, and you throw it away in the trash can, and then you wash your hands. And I was like, wow, something that I am putting into my body that's going to be touching my mouth and my esophagus and my tummy, I can touch with both my hands? Really? So it's like a very dramatic process. And after you take it, you are radioactive. Yeah, you are like that song, and you can turn up that radioactive song by Imagine Dragons and listen to that like super loud on your way home, because you are radioactive. And after that, you have to isolate yourself. You can't be around your family members because you can make them sick, and you especially can't be around anyone who's pregnant, and you can't be around any young kids. But that's a given, like, duh. Because that affects how, in little children, their thyroids are still developing, and that affects how basically they could be grown with like a messed up thyroid, and that's not fun. Obviously, you should know. And anyway, you have to you just isolate yourself. I would use plastic and paper utensils and dispose of them. That way you don't have to wash them or put them in the sink and risk contaminating your other dishes and utensils. Wash your clothes separately. After this process is over, wash your bed sheets. After you use the bathroom, wipe it down with Clorox. Just be like super duper clean, like OCD crazy clean. Like, yeah. Just be careful not to hurt your pets or your family, because that would suck. But before you do this, you're gonna have to sign like all of these crazy forms. And I think the worst one of those forms was being told that what you're taking to prevent your cancer might give you leukemia. Yeah, I would rather have thyroid cancer than leukemia. But that's super rare. That's just a very tiny itsy bitsy risk. But it is something that you have to sign on a form, like, you know that what you're putting into your body can hurt you, and that sucks. That's not fun. And then if you wait like I think it's a month or a few weeks, I can't remember, you go in and you do your full body scan. And if you've never had one of these done before, you just lay down on the little bed thing, and that like donut thing just kind of circles around you, and you lay there for like 30 minutes. It was the first time I ever had that done, and I started crying. Obviously, I'm very emotional. I cried a lot during this experience. It was very sad and scary and not fun. But and also I'm very claustrophobic, and it was very sad. It was like it was a very real experience. Like I hate it. Like I think about little kids that like have cancer, that have to lay in those things like all the time. Every time I have to get my blood work done, I think about it, and I'm just like, it's very humbling. It really is. Getting diagnosed with cancer is a very humbling experience. But it makes you stronger. It makes you appreciate the little things. It makes you want to be healthy. So it's good. And like I said, I do feel better. I know right now, if you've just been diagnosed, or you think you might be diagnosed, I want to reassure you that everything's going to be fine. You are going to be fine. And it's better after it's all done. So don't wait. Just do it. Just dive right into it and get all your stuff taken care of, and you will feel better. You really, really will feel so much better. So yeah, just I don't know. Just be brave and know that everything's going to be fine. It really is. Getting diagnosed with thyroid cancer is not the end of the world. And, but yeah, so that's pretty much all I have to say about that. I think I left a few things out. That's okay. If you have any questions, or if you need any support, or just someone to talk to, vent to, you feel free to leave a comment, or you can message me. But yeah, I'm like definitely here for you, and I can help you and support you and comfort you and everything, because I know like during that time that I was going through it, having support through social media with people that were going through the same things was definitely helpful. So yeah, I hope this was helpful. But yeah, I guess this is a good place to end it, because I'm just rambling at this point. So